Kia ora, ko Sarah Townsend, tōku ingoa. I'm a principal advisor for the New Zealand government, but today I'm here as a fellow of the Winston Churchill Memorial Trust to talk to you about the recent fellowship project that I did, which was exploring UK and Australian approaches to child and adolescent-to-parent violence, with the aim to gain that knowledge from overseas and bring it back to the work that we do here in Aotearoa, New Zealand. So just in terms of kind of introducing my project, why I focused on this topic and why it was important to me. So yeah, I guess it's true to say that this form of violence is not very well understood. Some would say it's quite invisible within the wider family violence kind of discourse. There is not much reliable data on the prevalence of this form of violence. For my project, I was able to obtain some figures from New Zealand Police, but also looking at international literature, which gave me an estimate in the range of 3 to 10% of call-outs by police for family harm involve a child or adolescent using violence. I think the reality is that it's much higher than that. I know certainly anecdotally, and as I've gone out to present the findings of this fellowship, I've definitely heard that the rates are much higher than what we know in the data so far. And part of the reason for that is that families often don't want to call police for really good reasons, for fear of punitive responses for their children. And yeah, so I mean, services in Aotearoa New Zealand are really limited, inconsistent, and yeah, there's just not a lot of research in this space. So, but in terms of my personal kind of why I was interested in this project, I had the experience of speaking to parents that are dealing with this issue as part of some of the mahi I do here within the government. And I think it was just really clear to me a real sense of kind of hopelessness and just feeling that there really was nothing out there, that they were not heard, they were not visible, and they had nowhere to turn to. So that kind of was a real sticking point in my mind to say, you know, what can I do in whatever capacity I have to understand this issue better and to try and help inform what some of the solutions in this space might be. So that was kind of what motivated me to undertake this project. And I was very lucky and grateful to receive a fellowship to actually help me go out and to be able to do that. So the aims of my fellowship really quickly, as I've kind of already touched on, were to learn about what works internationally when responding to child and adolescent-to-parent violence and abuse, also termed AVITH in Australia and other definitions used elsewhere internationally, which is something that I'll comment on later in the presentation. I was keen to understand effective policy and system settings. So what do you actually need at different levels and different parts of the kind of response and prevention system in order to have an effective response? And I was also really keen to kind of meet other people, meet practitioners, meet policymakers, people with lived experience, researchers, and yeah, kind of build that network or a coalition of people that had knowledge and expertise in this space that could also help as New Zealand kind of develops its thinking and approach in this area. So I will talk a little bit about the UK and what I observed there. I'll talk about Australia and what I observed there, and also some of the context of where we're at currently within Aotearoa New Zealand. I should say these are very much my personal observations. They're based on the conversations that I had. You know, some of this is backed up with bits of research, but this is not an academic, you know, peer-reviewed piece of research. These are my personal observations. So looking towards the UK there, what was really clear to me is that there is some incredibly powerful driven advocates sitting at the grassroots that have been working kind of really tirelessly in this space to make some change. I would just have to make a shout out to Helen Bonnick, who is someone who has not only worked really hard to make visible kind of the evidence base in this space. So some people might be aware of the Holes in the Wall website, which is kind of a plethora of resources, evidence, research. But Helen was also personally responsible for setting up a roundtable of practitioners and policymakers in the UK to try and, you know, have that opportunity to exchange knowledge, make this topic more visible, and to provide a forum for, you know, practical change. So yeah, that's just someone who I, you know, had to mention. And the other person that I really thought I'd have to mention is Michelle John from PEGS, which is an organization in the UK working with parents and families. And again, as an advocate, Michelle's someone who has kind of worked tirelessly to bring this issue into the forefront, knocked on so many policymakers' doors, you know, and just those real kind of grassroots advocate kind of people that I was able to go and talk to. So yeah, I guess overall though, what I saw was that there was this grassroots groundswell movement, really driven by passionate people, a lot of whom had kind of personal experience with this issue, and that's what's kind of driven them to want to make change. But at a national level, it felt as though progress was really slow. I heard a lot of kind of frustration by the people that I spoke to in terms of their ability to engage with policymakers, that there was a revolving door of, you know, people in government. So when they've tried to engage, you know, and then people have moved on, and that's been really hard to create sustained effort and momentum, and also, you know, changes of government. So just seeing those kind of inconsistencies in those national level advancements. I would also, I guess one of my observations was that a lot of the work that was going on in the UK currently was quite parent focused. And I think that stems partially from the fact that it's driven by a lot of people with lived experience, seeing that gap for kind of support systems, networks, practical programs, and initiatives for parents, and kind of helping to fill that gap for other parents like them. While there are several kind of legislative frameworks that do have some provision to ensure that parents who are experiencing abuse are protected, there isn't really any safeguarding policy framework in every region. So people talked a little bit about a postcode lottery in terms of what sort of supports were available to them depending on where they lived in the country. And yeah, there was talk of a consultation by the Home Office that was looking to create some consistency of definitions, and there was some local safeguarding boards. So there was definitely a lot of interesting, promising practice emerging. So if I move on to what I observed in Australia, I think it's fair to say that it was a much more systemic and comprehensive approach that I observed, particularly in Victoria, where I focused and where I met most of the stakeholders. But not only did I see work on this issue in national level strategies, I saw it within regional strategies within Victoria. I could see quite a long timeline of funding for services and programs, which has meant that the practitioners working in those spaces have developed a considerable amount of knowledge and expertise. I was able to talk to researchers and find out about the funding that's been put in place to lead research projects in this particular area, evaluations of what's working, and then efforts to bridge the gap between practitioners and policymakers, and to create communities of practice to share knowledge and resources. So it felt to me a very comprehensive, top-down and bottom-up approach, and definitely one that I think Aotearoa New Zealand would kind of seek to emulate. It was really, I think, amazing to see the range of services that were available, particularly at state level in Victoria. Although I will say, obviously, that my understanding is that that's not necessarily replicated in all states across Australia. And yeah, seeing kind of integration with other systems and networks and links to policy. Yeah, so that was just, it was quite amazing to see that level of work. And I think one of the questions I asked, because I knew I would be asked, is like, how did Victoria get to that point? Like, what was the impetus behind that? And I know that like one of the responses I heard to that was a previous Churchill fellow that had done some work in this space, and also the Royal Inquiry and the kind of recommendations that stemmed from that. So then just thinking about or reflecting on how this currently looks within New Zealand, I think by comparison, there is very limited national focus on this topic. Currently, we are definitely lacking in data. There is little to no service provision that has a specific focus on this area, working with this cohort. There is little specific workforce training available. There are some emerging service provision and some research that's happened and some peer support networks that are emerging, but it's still very early days. And yeah, I guess in terms of how that links up with national strategy, it's visible within that, but as yet the action hasn't kind of flowed from that. So I think it was just, recognizing that we're starting from quite a low level. And so it was really, interesting to see where the UK was at and where Australia was at, and what different components of those approaches that we might think or consider to adopt. So in thinking about the key learnings, I think one of the most interesting things for me, and especially given that my day job is in family violence policy, was talking to practitioners and talking to researchers and hearing about that strong connection between witnessing violence in the home and then later child-to-parent violence. And I think it's really important to say that not every child who has been exposed to family violence, not every child that has experienced trauma will then, act in violent ways, but there are risk factors that may increase the chances of that occurring. And I think it was interesting because opinions were quite diverse so given that link, the opinions were quite mixed on whether then this topic, child-parent violence, should be considered within the broader family violence or, domestic violence, however it's termed in different countries within that context. Some people could see that offered some opportunity because most countries already have some efforts, some strategies, some action plans around gender-based violence, family violence, domestic violence. And so there's an opportunity to leverage off of those things. Others saw that it was related, but because it's so distinct and needs quite specialized responses, it should be kind of covered separately. And others were very much, I guess, opposed to it being to child-to-parent violence sitting within that broader domestic violence framework due to the fear that it stigmatized children as perpetrators and could lead more towards punitive responses rather than therapeutic, developmental kind of supportive responses. So that was just like a really interesting, I guess, finding that emerged for me that I didn't necessarily expect, those different perspectives on where in the kind of policy settings this topic should actually sit. So another key learning was around that strong correlation between children with neurodevelopmental disorders and child-parent violence. And again, obviously to say that not all children with those disorders act in violent ways, but it was very loud and clear that there is a correlation there. And obviously what that tells us is that the responses and the supports and the systems that need to be in place must be disability informed, and really focus on creating those supportive everyday environments, whether it's in the school, whether it's in the home. You know, I heard loud and clear from parents that are experiencing this issue that if you don't have a supportive school environment, you know, we know that kids spend a huge amount of time every day in the school, that if those are not supportive environments, and particularly if they're an environment that's not created for your way of viewing the world, that those frustrations can kind of, you know, bubble up. And so by the time you're out of school and you're in the home environment, that can be when that kind of all comes to the surface. The other thing that came through really strongly was the need for early intervention. People were saying that some of these behaviors were showing up long before kind of children were, you know, sort of 10 years old, but that those things may be minimized, seen as parenting issues, seen as just the way that kids are, or just not considered as concerning because of the child's size and strength. And it's actually only then when the children start to enter those teenage years and become a little bit more stronger, that then services start to become involved. And actually what everyone was saying loud and clear to me is that, you know, when those issues become apparent, whether it's within the schools or within a mental health capacity, you know, that's the time to really intensively work with the child, and that there was a strong suggestion that that would actually make some of those potentially more violent behaviors down the line, it would lessen the chances of that. So yeah, really pointing to the need for workforces to be trained to understand what those early signs might look like, and know what to do about that, how to recognize and how to respond, and what are the supports and services that might actually be helpful in that context. And then, yeah, the final kind of key learning from the project was around this idea of multi-agency responses. So we talk a lot in Aotearoa New Zealand about whānau-centred, and obviously it's recognising the multiple needs that might be existing within a family, and needs and issues, recognizing, you know, as we've talked about in terms of other issues that might be apparent, family violence in the home, disability, developmental delays. So the whole kind of gamut of things and issues and family dynamics that might be occurring, thinking about how this might impact on siblings. It might be a multi-generational household. So yeah, really just looking at the strengths of the whānau and the family, and how to like work across those different needs are likely to require lots of different agencies to come together to ensure a coordinated and joined up and integrated response. So from, you know, all of these things that I gleaned and I heard, and all of these amazing insights that were shared with me, I tried to boil it down to a couple of high-level recommendations for how we might consider, or at least start considering, how to approach this issue in Aotearoa New Zealand. So one thing was really around raising awareness. At the moment, this is not a topic that people are talking about as much in New Zealand, or are as aware of, although that's actually starting to increase more recently. And so, but as part of that, you know, you need good data, and what people were saying is you need kind of common, consistent, shared definitions. So you need to know what you're talking about, and you need to be able to kind of show how big the issue is. So kind of thinking about what data we need to collect and how this issue is being defined. But there's also that kind of counter argument to say, yes, we need to raise awareness, but if there isn't good service provision currently in place, you know, where are you pushing people to if there's nothing for them to, you know, get the help that they need? So that has to come alongside investment in services, both response services to respond to the issues that are happening right now. But as I said, what I heard loud and clear is that there needs to be a clear investment strategy into early intervention, therapeutic, family-based supports, And one thing that's been talked about a lot by the Family Violence Death Review Committee in Aotearoa is the need for an aftercare system. So this is thinking about children that have witnessed, for example, a family violence homicide, but actually any exposure to family violence. What are the systems of support available to the children within that home that can be accessed and activated at that point in time? In terms of a starting point, people also said, create a community. You need to bring together the advocates and the experts that you currently have within the country, but also, what was great was to hear, and we can support you. We've got people in the UK now, people in Australia that we're connected to. We're not starting from zero in terms of the information that's available. We can see that there's a lot of effort that's already happened in other countries that we can learn from. And I spoke about this a little bit before, but thinking about those key workforces, I heard, teachers, police, health, mental health, early childhood. So there's a heap of different workforces that would really benefit from understanding this issue, what it looks like, what the unique dynamics of this issue are, and what is the appropriate kind of response to that. It was a really amazing opportunity to be able to come out and just kind of learn and observe and see what was happening elsewhere. I've been asked to share this presentation and this report already with a few different groups in New Zealand and internationally. So it's really great to see that this little project of mine is able to at least start a bit of a conversation and hopefully shed some more light on the need for more effort and more work in this space. So kia ora, thank you for listening to me.